the sweetest sound that saved my life. I once was lost, but now I'm found. Was blind, but now I see. He took my shame, he took my pain. My Jesus gave me his name.
Good morning.
Good morning, ma.
Please can you introduce yourself?
My name is Eunice Niswem.
Can you introduce your mother to us?
My mother is Teresa Niswem.
Can you tell us a bit about your mother's journey? It is her cancer journey.
The thing started like infection. We thought it was infection that was disturbing her. So we went to several hospitals, but to no avail. Went to Paramedical Center Makodi. They now refer us to Shika. She started her treatment in Shika in 2014.
Please, can you tell us what she's diagnosed with? Which cancer?
Is cancer of the uterus. So she started treatment in Shika in 2014. But up to date, the thing is still disturbing her. She's bleeding seriously. She normally comes for checkup after 3 months. She was here last month. But after everything, they said there is water in her uterus. After evaporating the water, up to date, she's still bleeding. She have to come again this month.
Okay. I'm actually asking you these questions on behalf of my organization, Kunak Foundation and MMA. We are collaborating with them to take care of cancer patients. And the more they get to know the people personally, the more they can reach out to people. So at least you've given us a brief about your mother. We are going to put it in the file. We are going to put it in the record. Whenever we have something, we'll call you on behalf of your mother to come and pick it up for us. And we have a little token on behalf of MMA to your mother. This is Teresa.
This way.
This way.
Thank you, ma'am.
On behalf of Good morning, ma'am.
Yes, ma'am. Thank you, ma'am.
Please, can you introduce yourself?
My name is Talatu Adam.
Can you tell us a little bit about your cancer history?
It was last year, August. Before last year, August, I started bleeding. So I went to one of my sister in the church. She advised me to go for fibro test because that is how some people used to bleed like that if they have fibro. So I went to fibro scanning. She said I should go for scanning. I went for scanning and the doctor said that I don't have fibro. Then she came back and she told me that I should go to my hospital. I used to go to a hospital for my HIV support drugs. So when I went there, I complained to them. The doctor asked me to go to the gynae ward. Then the gynae doctor see me, then she gave me tests to go and test because she said she guessed it, maybe there is something wrong with me. So she said I should go for tests. I went for tests. When I came back with the results, she said what she was guessing is true. I have cancer of the cervix. I said I don't know what that means. She said it's inside the womb, the cancer of the cervix. So they will refer me to Shika. Then when I went to Shika, the treatment was too expensive. The drugs, the injection, I went through hell before I come out of the injection. Now, I need money for the surgery. I don't have money. And I asked them, they told me that it will go to 1 million. So I don't have who to help me. It is only God I'm looking on.
I overheard in your little brief right now, you said you are still taking a combination of HIV and cancer.
Yes, sir.
So how are you managing it?
I give God glory because I have a son that is 14 years and he's
Please, let's skip that topic. The reason why I asked you is because I'm also a HIV counselor, and I know how difficult it is. And just going for your CD counseling, I know what it takes. So I'm asking you not because I want you to cry, but because I know the combination. Personally, I've been diagnosed with, I was diagnosed with breast cancer first. I went through the treatment. It affected my liver. It went through my intestines. I've had all the surgeries except this last one, which is my stomach. I'm asking you because from a personal experience, as fighters, we talk together, we share stories, we support each other. I'm not asking you because I want you to cry. I'm asking you because I actually know where you're coming from. My combination may not be HIV and cancer, but I have been through a combination of the liver, the intestines, and cancer itself. So I know where you're coming from, especially as a mother. Some of us, especially mothers, as we are fighting, we are constantly reminded that we have a reason to fight. And the reason we fight every day is for our children. So when you talked about your son, I knew where you were coming from because I'm also a mother. And I always say, even on my Facebook page, that the reason why I'm alive is because of Maya. And even Maya was not around, I know I'll have been long gone. Because sometimes when cancer pain alone comes, you don't really want to give up. But when the pain is there, you don't have the money, and you have some family members that you know you can help, but they don't want to help, you get frustrated sometimes. So that's just the only reason why I'm asking you. So my sister, I don't want you to cry. We're a support group. We're always together. We've come to a family. We call ourselves Kunak family, not because of anything, but because we act as a family. We're always together.
I was totally down, getting to the extent of death. Then they asked me to register in one orphanage home. He was just 2 years, and they thought I will not survive. So they asked me to register in orphanage home. So that is why where the boy grew up to 6 years. Before the woman was about to go to Abuja, back to Abuja, then she called me and gave me back my son because she see I am okay now, I can take care of the boy. Then she gave me the boy.
Is he taking his drugs?
Yes. We used to go to St. Gerard. And the St. Gerard, they used to ask us for 500 naira fee. And for this viral load and CD4, they used to collect 200. So if we don't have the money, we will be there. Now he has appointment. And because I don't have money, Father 500 to go and collect his drug, we have not gone.
From today, through NTP, I don't know if you have an account number. You have an account number. My secretary will collect it. And on behalf of the house, the entire house, which you are a part of, we will continue giving you. This is just, we're talking about 1,000. 1,000. We will give you that. We will continue giving you that. That is on behalf of the entire Kunak house. That shouldn't be an issue. And I will talk to the Reverend Sister too of St. Gerard's. I think they can do better. I will go and see her tomorrow morning. I will take your case to her. But please don't feel anything. Their clinic days are Wednesdays. Because I work with them too. I remember that. Yesterday was Wednesday. But he can go.
He gave us tests. They gave us a CD4 test.
Okay.
And we have no pay. So we cannot go for the CD4.
Go tomorrow. Go tomorrow. You pay for it. I'll give you the money. You go, you pay for it. And from now on, just talk directly with me. I'll give you my number. If you cannot get me, you get my secretary. Just feel free. If you cannot get me, you cannot get my secretary. Get Auntie P. Auntie P knows how to get me at any time.
She's a sister to me.
Please, don't feel anything. I'm just angry right now. But we'll take care of it. Just a form of support. But we plan to do big things for fighters, as I said. So on their behalf, I would like to hand this over.
My dear.
Please, can you introduce yourself to the house?
My name is Patience Achi.
Can you please tell us a little bit of your cancer history? I would like to know, please.
Just like my other sister said, I discovered bleeding. That was in 2013, precisely December. So I went to Baraudipo Hospital. In fact, I could not get any help there. So I decided to go to 44 Hospital. I spent a year there, from one scanning, test, whatever it is, even pap smear. They did not discover anything. So at the end of the day, the doctor now told me that they have not seen anything wrong with me, but what is suggesting that my womb should be removed. And I said, no, you have to find out what is really wrong with me before you removed my womb. So I stopped going. So I came back home. I stayed for like a month. I went to Garden City. The nurse precisely just introduced me to Dr. Amir there. He too started his own. He said it's an issue of irregular menstruation. I said no. If only you will say it's an issue of maybe disease or any related something like that, but I will take it. But if you say it's an irregular menstruation, I've never had that issue. So after 2 or 3 visits there, I stopped. So on a particular day, I told my husband, there's this hospital you are asked to go and open from your office. That's Mint Hospital. We went there. So the very first day we opened the card, I said, look, I'm not going back. I have to see a doctor today. So when I went to the doctor, I explained my situation. He said, okay. They will now call on their gynecologist. So fortunately for me, it was the same doctor at the Baraudik too, at the gynae there, Dr. Caleb, I think. So he now booked an appointment for me. They called on me. I went. He said I should lie down. In fact, before then, I went back to to 44. I have to steal all my tests on there for him to see. So when he went through, he said, all these tests, nothing was diagnosed. I said, yes. He said, okay, I should lie down. When he checked on me, he said, madam, I can see something, but I want to be sure. So a biopsy was done. And he called on me, he said, this is